true. Because then you have some dumb picture. 100%.
All right, I am plugged in, presumably.
We
are going live.
I would love to talk about
a whole 2 seconds. There's comments.
I would love to talk about the mushroom medicine making one.
Yeah. Yeah, I was going to leave that one for you as well.
Is there? Let me see.
I am on.
Watch live.
Awesome sauce.
Turn down my stuff.
Oh yeah, turn your stuff down. Let me turn mine all the way up.
I'm going to say hi to you, Bob.
I see you on there.
All right.
Oh, and Lauren's there. Oh,
hey, Lauren.
We got peeps. We'll get started here in just a minute. I'm working out the technical glitches. Welcome. We're not here.
Last one.
Wyatt. You've been rocking it, man.
What's up, Wyatt?
Good to see you on here.
Hey, buddy. Last one. Could you discuss in depth through Woodruff and elderly?
Do you want to go say words with those people? They're very excited to be taking pictures.
Lots of room. Let's see, Woodruff. No, they're on their way.
Oh, okay, never mind. No, there must be a baseball game tonight.
Yeah, he's got his Longoria on.
All right.
Does she mean
We'll get started here in just a few minutes, in like 10 minutes. So hang out, post your questions, let us know where you are in the world. I know a few of y'all are already from interesting places far afield. We will get started in about 10 minutes, so get your caffeine and a piece of paper and a pen and prepare to scribble. Gallstones. That is always a challenging one. We will add that to the question list, and I will go try to find the formula for that and pull it down so we can show it off. Here. Say hi, Renee.
Hey there. Let me know if you have any questions as Bob's getting his stuff together.
Because I can't remember the name of it. Say something intelligent.
Always. There's nothing I don't say that isn't intelligent. I say stupid stuff all the time. Please, you guys, I am here to moderate for Bob, so if there's any questions for any reason, any way, shape, or form, let me know. Go ahead and fill it in, and then don't forget that we're on a delay, which means we may answer your question after, like, it looks like we went on, but we come back. So please don't hesitate to bring something back up that was at the beginning of the night. That's completely fine and okay. Just let you know.
Brain cramps sometimes. I spent the day on top of a cherry picker, 40-foot lift, chopping tree branches down. So
it was very impressive.
I'm a little sun tinged at the moment. We'll see how well my brain works.
Very impressive.
Oh, that's funny. I bet you that's that person trying to phone in. Oh well, we'll figure it out. Gallstones. Wyatt, you've been busy, man. I see you popping up everywhere, and you're always asking us interesting questions. So feel free to yap at us for any of those interesting ones that are challenging you. I think you chatted with Renee a little bit about one interesting case you had.
And you.
Oh, an acute issue. Oh.
Yeah. He's got some crazy stuff going on that he's dealing with.
Sweet. Well, we'll make it an interesting case discussion. We got a couple of things that are already posted, but they always got time, man. Yeah, I'll be curious how your, I think it was leukemia client you had recently. So that's always a challenging one, but we can do good things with that, with the cool herbiness and, of course, boring things like diet.
Yeah.
And for anybody who's just jumping on, we'll get started here in a few minutes. We'll start right at 6 o'clock, and I'll start babbling and do my selfless promotions and all the rest of the good stuff that we always do.
Yes. Can I
Nothing.
help
I was
you?
cheating and looking over your shoulder. And
I'm just making
like,
sure we're covering. I'm covering like
Yeah.
African. You know what I mean? Like, and I'm writing down. You do need me to write a question down. You said. We'll add it to our list of questions.
Gallstones.
Okay, that's all. Just like a general discussion about gallstones.
Yeah.
Okay.
Gallstones bad. Don't get them. Actually, I have much to say about gallstones.
How about plaque in the arteries? You have much to say about that?
Plaque in the arteries bad.
It's very helpful. Very, very helpful.
End of conversation.
Yes.
Lauren, where are you these days? I've lost track of you.
Might be here.
Oh.
Maybe she might be back.
Well, I don't know. Oh, I'm guessing you have the gallstones, the gall of those stones.
Yes. Okay.
I've heard they suck.
You can't imagine that they're fun.
It's really confusing because Renee's on her computer over here, and there's like a minute delay. So I'll glance over there,
No, don't.
and I'll
Don't
see
ever look.
myself doing that.
Don't ever.
And I get dizzy because I'm like, wait, I
Yeah.
just did that.
I'm gonna turn it so you can't see
Deja
it
vu all over again.
because it messes you up. Like it's bad. It's hard. It's like trying to talk when you can hear yourself.
Yeah.
Mhm.
It's super exciting. Looks like we got 8 people on here. For anybody who's just jumping on, we're going to get started here in 5 minutes, right at 6 o'clock, and I will babble endlessly. Feel free to post your questions
Okay.
ahead of time, and
I'm gonna
Renee
keep
will jot
highlighting.
them down, and we will queue them up. So far, I think we can get through everything without too much trouble, and I know we always go farther afield. Oh, fun. A lot of people doing that these days, getting an RV and bebopping around. I'm like,
Is that Wyatt?
no,
Matt
Lauren. Yeah. Oh my gosh. Howdy. We got all your questions ready. Got some good ones here. Those will keep me babbling for a while. You're first in the queue, I think.
Okay. So I'm gonna keep highlighting.
Yeah.
Okay.
It's funny, I had to go and look up Mike O'Tier's formula to see whether I liked it or not.
Well, because yin chow is yin chow, right? And
No, he's got his own.
that's what I'm
so-
asking.
Yeah,
That's
no,
what I'm
you-
saying. What he does to it may be different.
Yes, that's why I went and looked his
Yeah.
up so I could comment appropriately. So, yeah, we'll babble a bit on all of those.
It's funny because I'm teaching this weekend. Like we would tell
Oh,
you never
yeah.
to use it, and
Oh, that's funny. I'll let you.
I'm gonna teach it this weekend. I don't mind about the cleaning ears or the cancer. We're just gonna have an active discussion about it. Oh, she made a sweet gum oil. And
Yeah, no, from the
nice.
last class,
Yeah,
the last
love
open
it.
forum.
I love
Super,
it.
super cool.
Makes me so happy
Yeah.
when stuff works.
Sorry, we're just catching up on everything. Tennessee, outstanding.
Okay, is that Lauren?
No,
Maya?
Christina, and
Let's
a
see.
new name. So awesome.
Okay.
Boy, I hope you avoided all the rain from Ida. I heard it looked like it ran right over Tennessee there. Yeah, whole eastern seaboard, I think, got the deluge. We lucked out, although I was up on that 40-foot
No, you
cherry
didn't see
picker
the-
during the
we
tail of
literally,
it.
I was gonna say we literally were out in the middle of all of it.
Yeah, that was not the smartest move.
So we're looking at diet as well. Okay.
Yeah.
So.
Yeah, we got lots of dietary stuff
Do
to
you
say,
have
Meg.
any other questions? That you have stuff written down. Do you need me to write them down?
No.
Okay.
I'm hoping my computer is charging now.
All right. So 30 super active, still similar body type, history of sexual trauma, staff.
No, we're
Yeah.
gonna make sure that that's.
Difficult to get that staff dealt with. It's definitely not on because I'm plugged in and not showing it either.
You're not charging either.
No, we have to hit the button over there. Maybe it came out of the wall.
No, this one's still going.
I'm not charging either. I'll get a cord.
Yeah, I may have to leave that to you because I'm not sure.
Okay, I'll go look for a cord as long as you can
Because I'm
start.
not sure why it's not doing it.
Wyatt, I'll go through your thing, okay, and make sure that that gets on the list. I'll go back up in a second. Bob's just getting ready to start.
Yeah, that's not doing anything.
Damn, that's rough. Wyatt, from the get-go, you've always gotten some really tough things.
I was gonna say, yeah, you're showing me up
Taking
on
care
complexy
of
stuff.
Yeah, taking care of your community isn't always as easy as we feel like it should.
All right, I'm plugged in and charging now.
Oh,
Woohoo!
it's
Yes.
going? Okay.
I don't know if you are.
No, how did that happen?
I don't know.
You just switched it to another hole?
Yeah.
Why, there isn't another one, I don't think. Okay. Well.
Oh, sorry, I got to catch up on what Super doesn't sit still very well like me, so we bought it.
I have, the staff tends to stay once it's there.
All right. Sorry, I'm still reading, and then I'm going to get started here in 1 minute. Wow.
Yeah, mine still isn't going.
Okay, we'll trade back and forth.
I don't think I'll need
Bell's
it.
palsy. Oh, interesting. We're going to be talking a lot about acute stuff. Super interesting.
So we'll do Wyatt,
All right.
Gallstones, and then Wyatt, go back up and review, and I'll review it for
Okay,
you.
well, we got
And then Bell's palsy is part of Wyatt's one.
Yeah, so that's the acute issue he was referring to. And it is 6 o'clock, so we're going to get started. Looks like we got a fair crowd that started the day. If any of you don't know, I'm Bob Linde. I am an acupuncture physician
I'm Renee.
and a registered herbalist. And that was Renee, who's just run off into the other direction. And we are here doing the open forum with the Tradition School of Herbal Studies. Behind us, you see our, I'm scruffy. We're on vacation right now. See what I do on my vacation?
Oh my gosh, you just got called out.
No, for my scruffy face. So, yes, we're the Tradition School of Herbal Studies and Acupuncture and Herbal Therapies here in St. Petersburg, Florida. And we started doing this kind of with the start of the pandemic, just because we felt bad. We weren't getting in touch with all of our peeps. We weren't doing our free lectures and our not free lectures. And, all of our conferences got canceled. So we decided we needed to make sure that we were keeping in touch with everybody. And, of course, that on top of that, all of us were continuing our education. And so we started doing this and just decided, pandemic or no pandemic, we're going to keep doing this because we thought it was wonderful outreach. We enjoyed it. It's a little intimidating to open up to the entire world to kind of like, go ahead, quiz me. See what we can come up off the top of our head on so many of these issues. But so far, we've done okay. And of course, we'll preface everything like this does not constitute a medical treatment or diagnosis of any sort. Yeah, whatever. And I want to make sure that we let everybody know, starting Monday, we'll be back doing our intern clinic 3 nights a week. And of course, we have acupuncture physicians and herbalists here 6 days a week. So feel free to call and schedule an appointment, whichever is appropriate. And our classes are back both in person as well as online. So we do all of our classes. We're recording all of them, but we do live Zoom classes for all of those. Next week, we've got fun stuff. Always a popular one is the beginning smudge class that even if you think you know how to smudge, that's coming up on Thursday, the 9th of September.
Plus, it's bioregional.
Yeah.
Like we talk about other plants, so we're not.
And that's really the important part. Everybody knows to use sage. Well, sage doesn't grow in Florida. It doesn't grow in the eastern seaboard.
The word smudge is a very eclectic word. That's Latin and Greek and English, and
so
it means a lot of things.
That one usually fills up, actually. We don't think because of COVID, we haven't taught it in a long time. We're doing a free class, Back to School Herbs. Renee and I are both teaching that one on Friday, September 10th. And that one, definitely register. We'll do that on Zoom. So just contact the school and Tricia will send out a link for Zoom, traditionsherbschool.com. And the equinox, so celebrating the equinox is coming up the following week on the 16th of September. We also have the ongoing, once a month, we're doing a different body system. So anatomy and physiology for the herbalist. So that's coming up on the 23rd of September. We're doing the musculatory system. Our next open forum is on the 24th of September. It's usually the last Friday of every month. We've added a new segment in. We did a free Ayurvedic class And we've got 2 not-free ones that are much more in depth that our own Ms. Gray will be teaching. And I don't usually go on into October, but I want to put a save the date on there because Renee gets a lot of requests for her spiritual cooking classes. So looking at incorporating herbs in and a lot of intention. And ultimately, this is a class that, although you can do it online, it is definitely preferred to do in person because there is food involved.
I make all the recipes, and they're also medicinals that if you're an herbalist or one of my herbalists, things that we've talked about in the past are ways that we can incorporate our medicine into our food. Sneak it in there.
For any of you who are acupuncture physicians, and normally I even for the acupuncture classes, I try to invite our students, my Chinese students when it's appropriate. This one's really only appropriate for acupuncture students or practicing acupuncture physicians. Renee Eng from Sarasota is doing the Master Tongue Acupuncture Intensive on October 2nd and 3rd at this school. And I will put a save the date. I would say save the spot. Renee and I are teaching October 30th and 31st herbal first aid. So that'll be a combination of cool first aid stuff as well as lots of really unique things. Everything from field herbalism to working protests and so forth. So one of our favoritist classes to play with, without a doubt. And if you are interested in getting more involved in the programs, the Western Herbal 101, the next class is November 27th. We have at least once a month a 101 coming up for the next couple of months starting in November. That is the start for the Western Herbal program. And then the Chinese Herbal program for the hardcore starting in November, it looks like November 20th. So sign up soon because that one is, I think, about 3/4 full at this point. So it usually is filled up, usually by October 1st. We're full, if not almost full. All right. Enough of those selfless plugs, traditionsherbschool.com. Make sure this will also be posted on YouTube sometime this weekend. I'll get around to it. So you can find it there, and we do monitor the YouTube page. So check out Tradition School of Herbal Studies on YouTube. Make sure you subscribe so that you can catch all our cool new videos. I had about a dozen that are actually set to launch about once a week coming up.
Nice.
So, all right.
When we get to Wyatt's, he's added some information, so I'll just go through it for you.
Go ahead and throw a question at me.
Okay, so we're going to do a review. Last open forum, we had been discussing several things, and one of the things you mentioned was a honeysuckle forsythia thing, and there was a reference to yin chow.
Yes.
And so there was questions around yin chow formula in a general sense. Is it a replacement for something? What is it to the people who don't know what we're talking about? Is it replacement for something like an airborne or an emergency?
So do
you follow the directions? How is this other formula? Right. Any of that? Any large
and actually,
discussion?
Can you grab the yin chow over there? I think it's over there. Yin chow Jedu is the proper name. And I think it's in a yellow something.
I know, but I'm just looking for it. I gotcha. Keep going.
And this is actually, I don't remember whether it's classical or a modern formula. It doesn't matter. And there's a lot of variation of this formula, and it's kind of, that's the one I like. There is a lot of variation as to the ingredients. It's sometimes regional or company specific. There's some that are a little shady. I'm going to say it's not an expensive formula, but I would be cautious if it's under $10. I hate to say that. If it's under $10 and it's a Chinese herb, it has not been put through the proper safety lab tests and so forth. So I get very concerned when I see a retail Chinese herb formula that's going out that's even a week's worth of herbs that's like $5 and $6. I can't buy wholesale for that price. I pay 3 times that wholesale.
Well, think about buying us medicine at the grocery store over the counter as a prescription. We're never paying.
Right. Well, no. So it's just the quality. So you're not getting good quality, and it hasn't been safety tested. So yin chow is generally, for those of you who know Chinese medicine, It is our very early wind heat invasion, which is fancy talk for when you're first catching a cold or flu, that it has a number of different antiviral herbs in there that I would say is my go-to for folks if they're getting a low-grade fever, they're tending to run a little hot, that this is great if you catch it in the first, say, 48 hours or so. I have a unique way that I use it. It used to be, and I was doing a lot of traveling a few years back, and I would get sick every time I traveled. It was super frustrating. And I challenged immune system back in the day, thanks military Desert Storm syndrome. And I was really, like, yeah, I'm on vacation or I'm going to speak somewhere. And I'm like, I don't have time to get a cold. And I figured out that taking yin chow, and these were little tablets, were just compressed herbs, that using them as lozengers, when I got to the airport, when I got onto the airplane, and when I got off the airplane, and sometimes I do it when I got to the hotel room, and just sucking on them, or if you can't stand the nasty taste, I happen to like it. If you have to, you can just swallow them. But I felt like having it in there, there was some mint and some other things in there that nice aromatics that help to keep the germs away, if you will. You can also take it, I would say, every 3 to 4 hours for an acute onset cold or flu, especially when there's more fever than chills. And it was interesting. We were asked specifically about Michael Tierra's planetary herbs, and I like Michael. He's a fun guy to have coffee and cannolis with way back in the day. And there's, our program's better, but he's got
Our
a very
program's different.
Yeah, he has a very popular program and a product line as well. And I had to look it up. I don't use his products necessarily, and it had many of the most common parts of yin chow, but he started to add in a few things that are okay, but he had an awful lot of calcium and an awful lot of fillers and lubricants like the stearic acid and so forth, and silica, that I didn't feel was necessary. So I wasn't a fan of some of that, and I understand the need for that. I assume it's in a capsule, but
not your first choice.
Yeah, I would say yin chow by itself doesn't need to be messed with a whole lot. It's a good formula, and I would almost say that he's changed the properties of it a little bit to make it more for not the first 48 hours, and seems to be a little bit more geared towards the after that first 48 hours. And it's funny, if I were to mess with yin chow, that all the cool kids just call it yin chow. We don't actually say yin chow, J-U-P-on. That's way too many words. I would actually add some diaphoretic herbs. The Chinese talk about release exterior, what Western herbalists call diaphoresis, or make you break a sweat. I find that very few of, got the other side of the U.S., outstanding L.A. I find that the Chinese herbs don't actually make you break a sweat unless you start doing massive dosages. So I think that the Western herbs, things like elderflower and yarrow flowers, and even some really boring things, they're not boring, they're amazing, like chamomile, that in the appropriate dosing has a better diaphoretic, especially elder. I feel like elder is just such a winner for release exterior. Yeah. And so if I were to mess with yin chow and make it my own, I would probably add something like that in. I think I answered the question. So
kind of. I want you to, I need to go forward with it a little bit with you. The first thing is Kristen comments a pill, not a capsule, so like a tablet. Like
so a tablet is what I prefer. Oh, sorry.
Yeah, so that's why I want you to show.
They don't pay me to do this, but I like Mei Wei's. Whoops, there we go. Mei Wei's Yin Chow, and this comes in a bottle in a couple of different ways, and they're just little tablets. So they're just compressed herbs ground up into a powder and compressed. Mayway plum flower.
That's one.
And you can find those online. We sell them, of course. And not something you take every day, though. This is, when we're talking colds and flu, we don't want to take antibiotics every day to prevent a bacterial infection. We take it when we're starting to get that first initial onset of symptoms. So not an everyday kind of thing.
Okay, so I need you to expand slightly on it,
Yeah.
and it's going to come up later on in the hours that we're talking, so it's important that you expand on this now. You said something that everybody doesn't know what you're talking about. You said wind invasion.
Yes.
And so I would like as brief as you can, because we're not in Chinese medicine school, like, let's talk about things that you could consider wind invasion and how that would present as a symptom on the body.
So I'm going to give
I'm going
to give the long version of that because it's one of my favorite subjects. So when you're in acupuncture school or when you're in herb school with Bob, we look at kind of this timeline of Chinese medicine, and we see this separation of this very shamanic kind of practice started to be neutralized and removed from Chinese medicine around 5,000 years ago. So from 5,000 to 10,000 years ago, we had this very shamanistic practice where we saw spiritual invasion, and we thought of invasions and evil spells and things like that were the cause for disease and so forth. And then we started to look at this more standardized way that we look at disease and medicine. And it was still using an energetic system, but we took some of the magic out of it. And what we do is we find little places where it's still allowed to be into the medicine. And one of them is the idea of evil wind. And so we say that disease travels on the wind. We call it xie qi, evil qi. And our wei qi, or our immune system, is what protects us. It controls our ghost gates, which most of us think of as skin pores. And so this idea, and it's fascinating because one of the premises when if any of you don't know this yet, I've got a TV series in Ecuador with Inti TV. So you can go on Inti TV and search for Linde, and you'll see a 12-part TV series there, where I got to visit with a variety of different shamans with different from traditions, the Quichua people and all their different units, groups within the Quichua. And my premise was that all of these traditional cultures had the same ideas. We use different funny words, and so whether we call it release exterior or diaphoresis or whatever, but when we look at Celtic European medicine, when we look at the various North American First Nations people, when we look at the Quichua people, the Caribbean people, when we look at Ayurvedic Chinese and Nani Tibbs, all of these great traditions, that they have similar thoughts and ideas, and we find some of these herbs grow throughout all of these traditions, and they all have these similar ideas. So this idea of wind evil invading through our skin pores, through our ghost gate, is a ghost, an evil entity that enters our body, and we have to drive it out by breaking a sweat. And so that was a very long way of saying to release the exterior is diaphoresis, breaking a sweat, to get rid of that wind invasion. And my running joke is, your mama probably told you don't go outside with a wet head or you catch a death of cold. And we know germ theory, it exists, and that a temperature change should have no impact on our ability to fight and defend against virus, bacteria, or fungus. And the reality is, if you're up north in the middle of winter and you run outside with without a shirt on, and you get a wet head and you get chilled, you're going to be sick the next day, or very likely to. And so there's aspects of that, and I found that the idea of evil invading you when you're weak and exposed, traveling on the wind, is true in most traditional cultural people.
Okay, so
Renee, you
there's
had
two questions.
Yeah, I know.
that
I
goes
opened
up.
up a can of worms now.
So the first thing is, can you give, and I'm going to prompt you if you go crazy. Okay. Can you give 1 or 2 or 3 symptoms that would show you had wind invasion? Something like, in our case, something like a tremor or...
Yeah, so wind invasion,
palsy
usually
or-
we look at it as a cold and flu. So chills and fever, aversion to wind. Literally, I remember my mom as she was getting older, she was like, I don't want to sit there. There's a draft from the AC vent. And it would make her eyes water and sneeze. And so it'd be like she was catching a cold. And it was literally from a cold wind blowing on her. And so this idea of aversion to wind, where you're like, oh man, it's so cold out, I got to move my collar up, is a type of wind invasion. It could be drippy sinuses. It's going to be an acute onset.
How about people who get like Bell's palsy after a cold?
And so, contraction, especially from wind cold, from a cold invasion versus a heat invasion.
And I think it's important to say that because doctors don't understand that, and I feel like you do.
And because Bell's palsy is going to come up later, and I'll touch on it a little bit for Wyatt here. It used to be called truck driver's disease, and now they've got computers to not allow them to do this, but it used to be the truck drivers would just drive all night. They'd go 24, 48 hours. They'd do all of their speed, and they'd stop and get the crappy coffee. They roll down their window, so they're exhausted. So their chi is weak, their energy is weak, they're susceptible to stuff. They'd roll down the window, and the wind would always blow on the left side, because here in the States, drivers on the left. And so invariably we saw a higher incidence of Bell's palsy, which is one of the cranial nerves being attacked by a virus, according to Western medicine. Actually, they don't really understand it, but it's some sort of dysfunction of a cranial nerve.
Like you have a good understanding.
But they use antivirals sometimes for it. So it was almost exclusively would affect the left side of the truck drivers, and there was always when they'd been pushing too hard, and we still see that today. We don't see a bunch of 20-year-olds with Bell's palsy because their energy is good, even though they're pushing it. Their chi is strong, their essence is strong. But when we get run down, we see people showing up, and I'm going to say, I bet 70% of the time, I can find a wind that was blowing on them. There was also a thing called Saturday Night Neck that we consider a wind invasion.
I get that.
And Saturday Night, well, not exactly how I describe Saturday Night Neck. Saturday Night Neck was you went out drinking all night.
But like if I get blown,
we don't go out drinking a whole lot.
But if I'm outside and get blown in the night.
So Saturday Night Neck was people go out drinking and partying until 3 o'clock in the morning. They come back, they turn on the fan because they're sweating from all the hot alcohol. They pass out in a funny direction, and literally that fan and AC that they crank down is blowing on their neck. They wake up and they're like, oh my God, I can't drive my car. And they go to the ER thinking they broke their neck in the middle of the night. And literally the ER docs will call it Saturday Night Neck and just give them an anti-inflammatory, antispasmodic, muscle relaxant. We would use something like Yin Chow. I personally like using formulas. Sorry, I'll type it in because it's crazy Chinese words. But you could use Western approaches to show Chai Hu Tong, or Guizhi Tong.
And then we have a question.
All right, I'll stop talking now. Yes, what's the question?
So, is inflammation considered chi stagnation?
No. So that's my short answer, no. So it's really one of the great challenges that we have. Chinese medicine is such a unique paradigm that it is this unique paradigm of medicine of how we describe disease and we approach it, this idea of hot, cold, wet, dry, deficient, excess, tense and lax, chi stagnation, blood stagnation. And to try to put some of these Western thoughts into it, like, is it inflammation? Inflammation is more associated with pain, and chi stagnation can be pain. But the nature of chi stagnation is usually moving pain. So we would see it more closely related with something like fibromyalgia. We usually look at it having a relationship with stress. And certainly stress can be inflammation. But we have so many different types of inflammation. And within the Chinese paradigm of understanding, when we look at inflammation, we think of it as hot. So if you had a tennis elbow and it was hot and swollen, we would say, oh, your elbow's inflamed. And then we'd put cold things on there. We'd put cold herbs and things like that. We would take cold herbs internally. But the reality is not all pain is red. Not all pain is swollen.
Not all cheese stagnation.
Something, yeah. So chi stagnation can show up as depression, irritability, and anger. It can show up as an irregular menses. It can attack different ways. So inflammation literally doesn't translate into Chinese well. All we can say is, where do you have inflammation and how does that show up? So does cold make it better or heat make it better? Does it feel good with pressure or not good with pressure?
And that's how we determine the formula.
And so then based on that kind of questioning, how long it's been there, does weather affect it? Does movement help or hurt? All of that would help us narrow down what's the imbalance in the body and put together the correct herbs or herbal formula for that, rather than saying, here, this is a good anti-inflammatory. Iceberg lettuce is a good anti-inflammatory in the right circumstances, but I don't usually recommend it, although I like it in my salad. All right, okay. I'm going to shut up with that.
All right, so I'm going to give you a rundown of the next one, and you can stop me even though there's many pieces to it. You can be like, let's just handle this and then go on. Okay, so we're going to talk about shingles, which, by the way, you guys, it's important to talk about shingles because it's a virus, so we might be able to translate some of what Bob and I are going to say over viruses in a general sense, and we just talked about invasion, and a virus would be an invasion.
It fits well into this.
Yeah, for sure. So we have somebody who said we have 2 people in their life that have had an outbreak of, not related, an outbreak to shingles, one being after a vaccine, and it being very specific to the left side of the body, has traveled up along the outer ear and thigh. Within that, prescriptive antiviral things really didn't do the trick. Yeah. They were prescribed that and it was whatever. So, do you want to stop there?
Yeah, let's just, I mean, she did some good stuff, so like we're going to go, way to go, Kristen.
Okay. Well, yeah, she wants choice. To know stuff because they're 2 totally different paradigms.
Yeah, go ahead and keep.
Okay, the second one was after a vaccine, there was an outbreak, and not, she deems it as controversial, and we're definitely obviously not going to have vaccine conversations, but it's very, very normal when you get vaccinated for anything that you have an outbreak of it, because that's your immune system seeing it and going for it and attacking it. And so we want it to be slightly present for that reason. And that one, there was no relief until she did some herbal stuff. So the medicines did not touch it. And we have a few questions about the medicine, the herbs, mushrooms, lifestyle, all of that. So let's just start with that.
So it's so funny. I would say in my first few months as a treating intern in acupuncture school, I had somebody come in with some pain in their back, and
I know what you're gonna
I
say.
looked at it and I was like, I'm pretty sure that's shingles, except I was taking pathology at the time, so I knew that shingles was the common name. And so I used its proper name. I was like, well, I'm pretty sure that's herpes. And so if you didn't know it, herpes, I believe it's herpes zoster, is shingles.
Chickenpox as well.
Yes, and so there's 13 different types of herpes. We always make, in our brains, when I say the word herpes, everybody thinks genital or oral herpes and think of it as a sexually transmitted virus. And the reality is there are many types of herpes virus, just like we have coronaviruses, we have herpes viruses, and so forth. And so she was quite adamant that she did not have herpes. And I figured out the huge glaring error I had made by calling it by its proper name. And I note to self, use the not common or the common name and call it shingles. People prefer it. But the reality is, just like with many of the
crimes. I would have been mad at you too if you're like, you scream out and you got herpes through the office. Yeah.
So what happened was when we look at any of the herpes viruses,
or any viruses,
but specifically those, because they tend to be chronic, that all of us have the potential for that in us. Of many of those, the Epstein-Barr is a type of herpes virus, and so over 50% of the population has Epstein-Barr, and what happens is under stress and when we get run down, that's when viruses have a party. And we see that start to show up. And so we can see shingles show up literally at any time in our life when we get highly stressed or our immune system gets run down. And stressed, we can say, oh, my job is super stressful, but we can also stress our immune system. In this case, we saw the vaccines had stressed the immune system. If they had, say, low vitamin D going in, they got the vaccine. If their body's immune system wasn't doing well, didn't produce antibodies, it would have stressed it and maybe allowed for the shingles virus to have an outbreak. And I won't say it's normal. It means, check your vitamin D levels, manage your stress better, eat a little better, things like that to help prevent it. Certainly controversial, there now is a shingles vaccine. Notice they didn't call it a herpes vaccine.
Oh, it's a herpes vaccine.
So there's a shingles vaccine that's recommended for folks.
I got your medicine for your herpes.
It's funny. I recently went to see the doctor for the first time in 10 years. Just I was like, I probably should. I ain't getting any younger. And she offered it to me, and I smiled and said no. And so I was like, I'm going to check my vitamin D level instead. So when we look at it, so yay, we just said lots of medical stuff, and I just like, no, don't use Western medical stuff. The energetic system describes shingles very well. If you've ever seen it, it's hot to the touch. It's red. At some point, you'll get blisters that start to show up. So they're water-filled blisters. It's painful. It's usually neuralgia, nerve pain, and it tends to affect one side of the body only. It can affect more than one side of the body. It's just rare.
Have you ever seen it bilateral?
Yeah.
You have?
Yeah, and it was weird. And
the doctors. Do you think they spread it?
It could
themselves
be
by accidentally.
Yeah,
I've never seen
it. And it is
bilateral.
contagious. So if you're like a significant other or something, and you see a bunch of little red dots that are following a dermatome, and that's the nerve coming off of the spine. Don't touch it or wash your hands if you do touch it, or wear gloves, especially if you're doing some topical herbal medicine and so forth. And I will say, we see it often enough here in the clinic, if we're doing acupuncture, we're like, what's all that weird red stuff? And I will say, it's super easy to miss the initial stages of shingles. It's mildly red with a few odd dots that you would just write off of like, oh, they could be bug bites. Tell me if I can
add into this. You keep going, but if I'm allowed to add in, I'm
yeah, of course. And so really we kind of have to look at everything that's going on. Have they been more stressed and run down? Are they in we see it more commonly after the age of 50, but I've seen it in 20-year-olds. And so, if there's pain associated with it, it will be pain on pressure when you touch it. And it'll sometimes just be described as itchy or maybe a feeling hot. I frequently, if it's on the thoracic or lumbar spine, we can treat it fine with herbs. When it's off of the cervical spine, off the neck, and starts to go towards the eye, it can cause permanent eye damage and blindness. So I tend to send people to the walk-in clinic to get the cyclovir and Valtrex or the and steroids, just because, the herbs work great and usually just as effective as that. I'm not willing to risk somebody's vision for it. If it's anywhere else, especially when we catch it early, usually we can use something. Honestly, you could use something like Yin Chow. I like a product made by Golden Flower called Viola Clear Fire. I forget what that's based off of. And then topically, it's funny, she used perfect choices.
She did a great job, for sure.
So Kristen,
lemon balm, licorice.
So lemon balm, Melissa officinalis,
St. John's wort,
is specific for the herpes virus. And so knowing that there are many types, we usually only think about lemon balm for internally and externally both, for genital and oral herpes, but this is specifically appropriate. It's in the Laminaceae, the mint family, so it has a little bit of release exterior or diaphoretic effect. So that was a great choice internally and externally. St. John's wort is specific for nerve pain or nerve stuff, nerve damage. Externally, 100% appropriate. Internally appropriate only if they're not taking any other medications, to include birth control. That the St. John's wort has the potential to interact with that. And then the licorice, because of its steroidal-like effect, again, appropriate externally and internally. There's other things you could use like Smilax, which is sarsaparilla in the islands, Greenbrier Smilax, Smilax medica, any of the Smilaxes actually. And then there's some other Chinese herbs, Viola Clearfire, can you? Oh,
Grab
you
it
got
off the thing?
No, you got it. There's a Chinese herb, Jingjie, that's commonly used for acute skin issues.
There's several things that I would, like, there's so many things. I would even go so far, for a reason that you wouldn't think of, is to use the chrysanthemum to wash it with.
Chrysanthemum
To
would
cool
be
it down,
appropriate.
to help dry up,
So
but keep it in
it's
balance.
important that we think about it. It's hot to the touch. It's an acute onset, and there's watery blisters. So whether we're looking at Chinese or Western energetics, it's wet, so damp. It's hot, heat. And because of the acute and severity of the nature, we usually call it a toxin. Good question about the board exam. You can't, unless you go to an accredited acupuncture school, you can't sit for the boards. In most states,
We used to have apprentice style.
you used to be able to
learning.
do apprentice, and it would allow you to sit for the boards, but for herbalism, you don't need to. Like, there's no licensure for herbal medicine.
Which means that you can practice as long as you abide by the laws of the place
Yeah.
that you're in.
So I would say take a class go to some sort of formal training in herb school. It doesn't have to be ours, as so long as they cover kind of the legal aspects of herbal medicine. It's super important. Unless you happen to be in a state that allows for apprenticeship still.
And if you're here, we teach that. And we
Mm-hmm.
teach what our laws are, and Bob has taught it even nationally for our large groups.
And I would say, so shingles, so
let's talk about
acute, so it's important to differentiate shingles because usually we get it in an acute phase. We can have good success. Acupuncture can have a role with it. I don't like doing it unless I have to, but there's a thing called 7-star needling,
that
which totally
freaks
sucks
me
to
out.
do.
Not that it's wrong,
but
it just
there's-
freaks me out.
What sometimes happens is and sorry, got to use the proper terminology. Post-herpetic neuropathy
Oh, good job.
and so sometimes if shingles doesn't get a proper treatment or the immune system's not strong enough, that you end up with this nerve pain where 20 years later you still have this horrible pain, burning, and so forth. That's hard. It's super challenging to fix that. Topical St. John's wort oil can be very effective, but utilizing some of your diaphoretic herbs like yarrow can be helpful, but I'd go heavy on the St. John's wort topically. And I'll go back to one of those formulas I mentioned earlier. We'll oftentimes use a modified version of Xiao Chai Hutong, minor blue plurum formula, in order to address that.
I do also want to say something, especially since it's Kristen that's asking. I would like to, and we can address what she's saying right there. So Kristen, in particular, for me, and I am somebody who gets shingles, has gotten shingles as a matter of it almost being chronic. I've been very good that I haven't had it in a while. I can have no signs of it and feel it coming on. For me, actually adding in milky oat tops helps with
thank you.
permanent
Good call.
damage,
Good
and
call.
it cools it down. So it's a restorative.
Forgot all about
Yeah,
that.
it's a restorative. And the second half of your question, we're like, can we do anything to reduce stress? Can we do anything
Yes.
with diets? I'm telling you that if you topically treat with the St. John's wort before anything shows, but she can feel it coming, and you're constantly on the milky oats, which it's an elder, she should be on that
And
anyways.
the Melissa,
Yeah, and the
balm.
lemon balm as well. that will start to bring it, like, chase it away. I haven't had it in a couple of years, but I used to have it 7 times a year. So I think that that's important, that you use those milky oat tops. And oat straw is not wrong during the year if you can't get milky oat tops, but milky oat tops will try to help prevent or permanent damage or restore what was there already. And she did have the lysine.
Yes, and that's I was.
She
like,
did a great job for sure.
I'm not sure what I just did there, but
the other thing is we want to talk a little bit about dosing of that. She was concerned about dosing and mixing with medication and things like that. And I just went into this deep dive with the lysine about can we overdose on it.
I was going to say, yeah.
I couldn't find any negative to taking too much.
Yeah.
Like I went to PubMed. I read for 2 days. I read studies from the Chinese. I read anything I could find to say anything negative. I went to Johns Hopkins, Cleveland Clinic, and Mayo to see if I could find a maximum dose for it. And there wasn't anything that I could find that was an issue, a maximum dose for it, which means you could heavy hit it to stop it in its tracks. And again, preventing permanent damage, preventing the blisters, preventing spreading. And so it's a good thing to think about for sure.
So yeah, let me talk really briefly about that. So with any of the herpes, usually we talk about oral and genital, but this is any of the herpes virus.
Any of
Too
them.
much L-arginine, which is in a lot of bodybuilding and energy drinks, like 5-Hour Energy drink, things like that, have the amino acid L-arginine in there, usually just called arginine. The L just makes you sound cool. And so too much, I'm trying to remember, some of the like red meats, alcohol, legumes, I think are all high in L-arginine. And so
supplements people give you.
Usually it's the supplements. So if you tend to be getting reoccurring shingles or other types of herpes virus, including Epstein-Barr flare-ups, reducing the amount of L-arginine and increasing or supplementing with L-lysine
So turkey
can be very effective.
Turkey, pork, chicken, pumpkin seeds, soy, peanuts, spirulina, dairy, high in
arginine.
the arginine. Mm-hmm.
You can also
Lentils.
take a supplement of L-lysine, and I've used high dose L-lysine for acute flare-ups of any type of herpes virus. I've also I've used it long term, just taking like 1 pill a day. And it's funny, Renee and I were doing some research on the lysine, and I was sitting there as like, the more we were doing some research on that not too long ago, when COVID, we're bored, so we start researching the crap out of everything.
Remember, it's all virus. Just think virus.
So it has a role not in killing a virus, not in destroying a virus, not in activating the immune system. It seems to have an effect on slowing down the virus's ability to replicate. And so I started taking L-lysine twice a day just as kind of a wild ass guess COVID prevention. And I've actually found a few protocols where people were actually suggesting the L-lysine 1 to 3 times a day for prevention, or not inappropriate early stage COVID to use that for treatment as well. So it couldn't hurt. And for just one more reason why L-lysine rocks is it helps with collagen production. So none of us are getting any younger.
Okay, so let's continue.
I was going to say, there was a ton of questions.
That's what I'm saying. There's like a string of things that came from that.
Yeah.
So
and we're good on time. We're not even in an hour yet.
I'm trying to pull my thing down. So one of the questions that there was some medicine making questions, so we can put it into there, is an infusion the same as a decoction? And we could talk about that in a minute if you want. And then could you explain, and I'm not going to say it right.
The Guernsey tongue?
Is that what it is?
Yeah, I think that's what it is.
Yes, could you explain that a little bit?
I'll do one better. I'll translate it. It's cinnamon twig decoction.
Oh, yes, of course. I know that.
So cinnamon twig decoction is a really interesting formula. So the chief herb in there is cinnamon. Cinnamon twig
is different, yeah.
And we usually think about it for a wind cold invasion. And let me explain that for a second. And so we look at for a wind cold invasion where you have an underlying deficiency, usually C deficiency. And I'm going to just say it, and I'm not even going to talk about it, but a disharmony of your yin and wei, doesn't matter. Uh, we can't explain that in 2 hours. But I'll give you the short version of this story. I did what every American does, that I go, ooh, these are good antiviral, antimicrobial herbs. I'm getting sick. I should take lots of these antimicrobial herbs. And I would go and get things like Andigraphis and dandelion and Tachus and I can't even think of all the ones. And I would just like, oh, I'm starting to catch something. I'll take a bunch of these things and I'll be fine. And there was this one time I had taught all weekend, and we had our Chinese herb school graduation that night. And so I had to run out of class and really burning the candle in 3 different ends. And I run into Publix, and I still remember I was getting a couple of snacks to have for after the ceremony. And I remember standing in the checkout line, and it was like probably October or November, and going to the woman is like, man, it's cold in here. And I'm literally like chilled. I was like, how can you stand working in here? It's so cold. And the woman looked at me like I had 3 heads. And so I got to graduation, and I was like, man, maybe I'm coming down with something. I've been pushing myself. So I did a whole bunch of my usual antiviral herbs and a little vitamin C. And it's funny, like the pictures from graduation that night, everybody's got big smiles and bright faces, and I'm like, I'm dying. And I woke up the next day and I was sick as a dog. And so I kept taking all of these same herbs, all of which were energetically very cold. And I tend to run towards C deficient and very cold. And I kept doing that, and I rarely am sick for more than 24 hours. And I was sick, and I was sick. I had to cancel my patients. And it went on like I was suffering. I was starting to resort to over-the-counter stuff. And I finally, after 2 weeks of like, I'm dying here. This isn't the flu. I don't understand. I'm freezing to death. It's like not even a fever or anything. And yet I had these horrible chills. And so finally I swallowed my pride. I went to go see another acupuncturist in the area who I respected and was a good herbalist. And when I gave her the lowdown, I literally had to drag myself in. She laughed at me. How dare she? She laughed at me. She was like, dumbass, you have a wind cold invasion, and all you're doing is taking cold herbs. You made it worse. So she gave me a warming formula, and within 24 hours, I was 100%. So I started to, I beat myself up all the time. I'm as guilty as the next one. I sneak into that medical brain, and we have to stay within our paradigm and play energetics. And so for me, the cinnamon twig decoction is phenomenal. When I feel like I'm starting to come down with a cold, forget the word antiviral. Cinnamon twig decoction, for me personally, because I tend towards cold. Whenever, like, we were out in the tail end of Ida on Wednesday.
And that's what we did.
And I got chilled. I was out in the rain, and I was in and out of the air conditioning. It got chilled. And I was like, I could tell the fatigue. I was feeling colder than it was. I literally took handfuls of cinnamon twig decoction. And I was fine the next day. So it's really important. So cinnamon twig is great for that person who early stage catching a cold, but has this underlying deficient constitution, tend towards cold, maybe a little wet, and then the cinnamon twig formula is magic. Where's your tongue?
So I hope that brings some clarity.
That was my long story.
Okay.
Where's your tongue?
And I'm gonna say comments that we were because in the question about the shingles and dealing with it, mushrooms came up, and I have Lauren saying that reishi mushrooms have worked wonderful with the outbreak as well as with the lysine, like it's ground it to a halt, and so that was a wonderful thing to know
the
about.
Reishi just helping with the immune system overall. And I would say the dosage of L-lysine with an outbreak of something is like every 3 or 4 hours do bottle dosage, and if you're working with a practitioner, you may even go higher than that.
Okay, so we're going to the next question is about medicine making, so we can incorporate the decoction infusion into that.
Yeah.
So in medicine making, the question that came across was specifically about double use of mushroom and whether you're getting the right things and proof of alcohol. So what the statement was I am making a chaga infused maple syrup, And we're supposed to decoct the chaga in water and syrup for several hours. And I'm also making bone broth where I use reishi and shiitake and turkey tail and whatever she needs to put in there. And she was wondering about reusing them after being decocted and putting them into alcohol, like a tincture, and whether or not the chaga is appropriate in the bone broth as well. A secondary question, sweet and savory. If so, we're going to tincture what kind of alcohol? Is it 100 proof? Is it not? Sweetness of the chaga goes into the brandy. What are the differences? Just like the general thought of reusing mushrooms. Yeah. And then the question that goes with medicine making that's on there is a tisane or an infusion the same thing as a decoction?
Yeah.
I have so much to say about all of that.
Yeah, I was going to say, let me make one short comment. Mushrooms have to be cooked to death. Eating raw mushrooms, although super yummy, you're not getting the medicinal benefits out of it. All mushrooms are good, even button mushrooms. And I'll avoid the question of psychedelic mushrooms. There's real benefits for those as well.
For cooking those ones too.
Yeah, but so as a general rule, cook the heck out of them. And I'm going to throw it to Renee about the whole double extraction. She is the expert in medicine making around here.
Well, you are a great medicine maker, but I'm happy and obsessed to talk about mushrooms.
Kill this mosquito.
So the first thing I'm going to say is, and then Bob and I will argue this a little bit, but not really, just out of practicality probably, that an infusion and decoction 1,000% are not the same thing in any realm of the possibility. Bob and I teach very eclectic medicine because we teach from plants that are tropical, we teach from plants that are Chinese, we teach from plants that are Western, whatever, all the plants, everybody to the party. And so we've come to a sweeping generality of most of the Western herbs, really in all reality, are light aerial parts, and an infusion will do. Even within our roots, they're not super duper hard roots and barks. So like a burdock root is more like a carrot, not like a hard oak root. So really an infusion to break through the cellulose to get the aerial parts medicine out is appropriate. The second thing with the infusion is it doesn't necessarily release the volatile oils or the aromatic properties, and that's a very important thing where a decoction would destroy them.
And can I say that
Please.
from a little Chinese?
Yeah.
Just because we do it a little bit different in Chinese. So as a general rule, and Renee kind of said it, like Chinese herbal medicine, we tend to use more root and bark, fruits and seeds, which are better decocted, where we'll bring it up to a boil, then reduce to a simmer, oftentimes for an hour, sometimes even longer if we're using rocks or animal parts and things like that, or toxic herbs.
Because I'm going to talk about decoction.
But what we generally do is we add our herbs with, think mint, volatile oils. They have an aroma, and sometimes those are roots as well. We have things like mushang, Aucklandia root, that those are added in the last 5 minutes, or sometimes with the very delicate aromatics, we might even take it, we're done decocting all of our roots and barks, and once we have the herbs strained off to the side, we'll throw in our volatile herbs so that we don't lose those volatile oils, because those are so vital. Those delicate volatile oils are so important when we're trying to work with a phlegmy condition, when we're trying to get that release exterior or diaphoresis, breaking a sweat. Those things are vital, and if we're just boiling away at that stuff, we're going to lose the good properties of all of those things. So the Chinese, we tend to do multiple steps, but that's not everybody's cup of tea. So I actually sometimes will use infusions using the Western herbs with some of my Chinese herbs thrown in, because it does do a good job of preserving those volatile oils.
So basically that was what I was going to say. So then we get to the decoction part of it, and we're looking at having to pull that space, those aromatics, those light parts completely out and off to the side. And when I teach it in a 3-step process just to get the decoction. It's a completely different animal altogether. There are times where you don't want the things that would come out in the decoction, and there are things where you wouldn't want the things, or the things would be released that came out in the infusion. Completely not the same thing at all. And in some cases, wasting medicine, like you're not getting anything out of it.
Boiling mint isn't going to do you much good.
Sucking on a rock isn't going to do anything unless it's a certain kind of rock. And so what were you going to say? Because I'm going to add more to
I was going to say, let's talk mushrooms.
Yeah, I was going to say, we're going to move this into the mushrooms. Now, Kristen, in particular, because these are your questions, it's important to understand that every mushroom is not created equal. That we have wood and shelf mushrooms that have a lot of gill to them, then we're looking at something that's more porous, more pliable, easier to access the nutrients.
The polypores usually we have to cook to death.
100%.
Where your not polypores are easier.
And the other problem that goes with that is, depending on what parts you want and what you're trying to extract, the proof will change too. So a good example of this would be reishi, as a general sense, is hard as a rock, even when it's fresh and wet and sticky. That you can get it off and tap, 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 and it's hard. And once it dries even a little bit, accessing that, we need to look at that as if it's a rock. And then the secondary side of it, to get the polysaccharide change out of it that we do need a super high proof alcohol. Now, if you said something like that for an oyster or for something like a lion's mane, and you used a super high proof alcohol on a lion's mane, you're going to get like a rubber bouncy ball that's unusable and you can't suck up in a pipette. That actually needs a lower proof. Now, weirdly, chaga, which is a different kind of mushroom altogether, that is noted and formed, and you're told to use formulas all the time where it's only water soluble, which we would really never tell you ever to just use one process. That would be an issue. And they only tell you to use one process. Lots of times you can buy stuff in the store. That is because you're actually ingesting that, and because there's usually a second thing done to it, like a second process, not either of those, like charring it, like we think Palsy when Bob teaches Palsy. So you'll char it, and then that will be used as a coffee substitute. So not only was it ground and the cellulose was broke that way, then it was charred and it was broken up that way, then it was going to be boiled like for coffee, and then you're having it that way. Just making a spot of tea out of it is near impossible for you to get much of anything out of it altogether. So not only is it acceptable to double use it, it's indicated to double use it.
I was going to say, so usually we'll, for things like bone broth where you might cook it for 3 days, that's probably good. You don't need to do a double extraction.
We're pressuring, we're vinegaring,
if you're just like, I'm going to decoct some chaga or some reishi, it is, as Renee said, you should boil the crap down, concentrate it, and I would say hours of simmering it, decocting it, and then take the mushrooms out and do an alcohol extraction with those. And a lot of people will add fresh mushroom for the alcohol extraction, where they're doing some of the cooked down, water extracted mushroom and some fresh. Not everybody does that. It's not necessary to do it.
I actually like that it's broken apart. Like, I feel like it would access more, but I also
the
want the good
chitin
stuff.
this hard covering, and so breaking that down. So double extraction is preferred, and usually with those polypores, with those hard mushrooms, higher proof alcohol is indicated. So at least 100 proof, but I would actually argue if you're doing that double extraction, I would go 170,
I would go
190.
with the highest you can get. If you can get 191, you need to use 191. The only exception is lion's mane. It will be unusable. It'll glob up into.
And so that's not a polypore. So those exactly. Hard mushrooms. So your hard mushrooms should be double extracted.
I don't even know if people understand what you're saying.
I know.
Say that.
Fancy
the only
botany
other
terms.
thing, Kristen, I'll tell you, like here's a tip. Here's something that people don't read ancient books. The Celtics or anybody up north would have put them out into the snow, and the freezing would have burst the cellulose open. That's another way that you can do it. So there's several tricks, like you can put it in the pressure cooker, you can put it in the Instapot, you can put it in a high proof alcohol, but anything other than just boiling it. You can freeze it to burst it in the
we're at our 1 hour mark, so what else we got?
Oh, we're plenty of time for sure. Okay, so I hope that was helpful altogether. All right, so let's do. This is up to you whether you want to talk about this, because I don't know if you know anything about this. One of the questions is about using rue, sweet woodruff, or elderleaf, and that's super controversial. All of that's super controversial.
I know some. I don't use them a lot because they're kind of intense.
And the
elder. So let me talk about elder first. So I'm going to generically say that unless you've done a clinical 2 or more year program, you should only use the berries or the flowers of elder and no other parts. They have cyanotic glycosides. There's your $5 word for the day. That is concentrated in the bark and the leaf. And although it is a strong antimicrobial and can safely be used topically, it can kill people to do it internally. So I don't ever recommend that. And I know that there are practitioners out there who are posting about using the leaf and bark of elder. I consider that irresponsible. A dosage or without a complete intake and the ability to process that with the liver and kidneys, if they're on medications, if they have any number of different health concerns, literally you could kill somebody with those. Also, generally doing those, the more you heat them or process them, you reduce it. So people are sitting there doing teas of the leaves. That does not destroy the cyanotic compounds in there. And the bark is very hard to destroy the cyanotic compounds in there. So I got issues with doing that for anybody who's not highly trained in working with toxic herbs.
Which, to that comment, all of these are considered that. All of these are considered to be herbs that you don't use. All of them are considered to be herbs that are toxic.
I will say the elder externally, sure.
I don't know that I would even go that far.
But it would be so far down on my list of useful plants to use topically. I don't know why I would.
Okay, so Kristen, let's everybody, but let's graze that because of the warning and the caveat that Bob just said. And ironically enough, to my advanced students, I'm teaching them about using poisonous and toxic herbs this weekend as part of this weekend coming. That's part of what they're learning. And so what I will tell you, because the information is out there, it's worth having a conversation about all of these plants that you listed, and it was rue, sweet woodruff, and elder leaf. I grew up from a folk standpoint and a witch standpoint, like a what we called wart crooner standpoint, using these. Like as a root doctor, is the people who are root doctors would have been the ones that were using these. We have better science now. Like there's lots of things that we did back then, like bleeding people to death and stuff that we don't do anymore. And we understand the reasonings, but we have better science. And so I can tell you, for what you listed for the elder, yes, we would and could use elder, the green parts, for things like tumor cancers. And into what Bob was saying, that topically, not an issue. Like we could totally use it. He is right. He has better things to choose, but he also has the largest apothecary in the state of Florida. And so if we were outside and we lived in the woods and we were just using what was around us, 100% as a topical for something to like burn something off or to heavy hit it externally, yes. Internally the same way, but the way Bob described, if somebody had cancer, then that means their immune system was very, very...
I hate to say, if somebody had constipation, you could literally hurt them badly.
Right. So it's something to just understand. If you're dealing, it would be like the same as using aconite, and I know that you understand that. So if you wouldn't use aconite just liberally because it was growing in your yard, then you shouldn't be using anything that has cyanotic properties liberally if it was growing. And so that's the way to think about it. That being said, from a spiritual standpoint, elder isn't elder. It teaches us the way, it binds things together, it holds good tissue together while dispelling the thing that is not serving. And that's the way you need to look at it. And so making washes with it, things like that, completely appropriate and known for baths and washes and stuff like that. The root in particular is exceptionally toxic in cases of, even though it's used as a seasoning, that's not a therapeutic dose. It's toxic in cases of kidney and liver fragileness in any way, like renal stuff. But as a protective, second to none from a spiritual use for protection and for topical, to make you invisible when somebody is hunting you, to reverse what we would call the evil eye, to use to bind, to lock, to turn things away from you, literally to hide. There's stories upon stories all the way from Greek soldiers up to the time of the Holocaust of planting it outside of a house that's hiding women in particular from the Nazis, and them just walking by the house, destroying the house next door, destroying the house on the other side, but ignoring the house in the middle.
How about the rue?
That's the rue.
Oh, that's the rue.
The sweet woodruff.
Okay.
And so now we're on to sweet woodruff is exceptional medicine with the toxicity as well. Very much considered an alternative, but most of our toxic purging things can be considered an alternative. Absolutely.
What's a good definition alternative?
I don't like this definition.
I know.
It's the definition that you're going to read. It's a blood cleanser.
Right.
And I don't believe our bloods are dirty. I believe they're in balance, and we need to bring them back into balance. So it helps to cool it.
For me, I always, when people say alternative, I always think of clearing heat. and
Yeah, I
chronic
can
heat.
say that. Yeah. And stuck too when I think of like blood toxin.
Sometimes
I agree with that.
some of the alternatives are
Sepsis,
invigorating.
it does feel like you need to clean that dirty, when you are septic.
Mhm.
And so it's known for things like that. It's also known for moving out, now that Bob said stuck heat, moving out stuck phlegm like gallbladder, kidney stones.
Don't do that one, Lauren.
It has problems with the kidney, the renal system. So you just have to be able to use it in good formulation, 100%. But what's important about that one, very protective for your body, spiritually, for men's health, especially sexually, that's spiritually, for turning a court case, for healing old wounds, for healing money issues. Both of those would bring in money, both rue and the sweet woodruff. And the other thing is 100% for binding somebody who was trying to attack you. So I want to point out that medically how similar that feels. If you had a blood toxin or you had sepsis or you had something in your blood, like blood heat, it would feel like something was attacking you and it would be binding that and sending it on. And so I can see it looking to somebody back in the day like you were having something attacking you and now it's not anymore. And so it would go a long way to that. I think that's the least of the bothersome ones. Just be careful that you're not giving it to somebody with kidney issues in any way, shape, or form.
So let's do gallstones, because that was
Yeah.
a good one in there.
So one of the questions was like, just in general, anything that we can tell you about how to deal with things like gallstones, which is a
So
bracket of
Lauren
things.
asked that, but it's funny. My running joke is whoever has the most parts that they were started with when they end life, that wins. So keeping your organs is always preferable, but there is a time and a place to get them out. And gallstones versus sludgy gallbladder, and a gallbladder insufficiency, the injection fraction or whatever it's called, all are potential issues with all of that. So gallstones, we frequently don't find out that we have a gallbladder issue until it's severe, where we have Thanksgiving dinner, or we have we go to the fondue place and eat too much greasy, fatty yumminess. And all of a sudden we're literally have chills and fever, vomiting, sometimes green bile, and sometimes a white or gray clay-like stool can all be signs of gallbladder issue. And it can be as scary as emergency surgery. Sometimes you get to take your time, and sometimes herbs help, sometimes they don't. And excessive intake of fats, and I'm going to put the evil blame on fried foods. Too many French fries and fried chicken, insert remove gallbladder here. And so 100% staying away from your fats. I hate to say it, milk chocolate, many dairy products.
Milk chocolate?
Yes, as opposed to good cacao. But even that has to be minimal.
Do you think gluten affects that? Because I recently found out there's a lot of gluten in chocolate.
Yeah, gluten can have an impact just because it's an inflammation of but it's fried foods is the big evil. It's not the only way to get them, but it's one of the leading causes.
How about good fats?
Again, minimal. Once you have gallstones,
That's so terrifying.
once you have a gallbladder issue, it's really hard. You have to become fanatical, and it's bad because you need healthy fats. You need your omega-3s and 6s, but to do too much is too much. Whatever you do, don't ever do a master cleanse, gallbladder flush, or any of that other crazy stuff. Too often that leads to emergency surgery, having your gallbladder removed, even if you didn't have a gallbladder issue. If you didn't have a severe gallbladder issue. What you're basically doing is causing spasming of your gallbladder, which if you do have a stone, it potentially can get lodged in your biliary duct and cause emergency surgery. Those things that you are crapping out that you think were the billions of stones are literally tar balls that you get when you put bile salts together with olive oil and malic acid, I think it is. So let's.
So you don't believe in the flushes?
No, it is that literally. They are
want you to be
dangerous,
clear.
dangerous. Do
Okay.
not do them. Run from anybody who advocates for them, and do your homework. You will find that, check. I think Paul Bergner has a nice write-up on it. You can find good stuff
He
on
does.
it.
I looked it up
Yeah.
when you suggested it for somebody, and it's great. I'm typing him in, by the way.
We like Paul Bergner. We trust him. None of us are perfect, but I trust him pretty quickly. And he'll usually give you references. So there is a number of different ways. If they just go, your gallbladder is tired, insufficient, sludgy, I find digestive bitters can be helpful. Things like anything from Urban Moonshine we like. Guido. Swedish bitters. There's a number of variations from that.
Us.
Us, we make a lot of, we custom make our bitters based on seeing clients. That's going to be most effective for gallbladder insufficiency, sludgy, I think I can still help myself. If you've had an ultrasound and they're like, you got stones, and those suckers are going to be an issue. There is malic acid, which is an extract usually from the peels of apples primarily. That comes from other sources. You can eat apples too.
I was
whatever.
gonna say just eating apples, dude.
Yeah, but the malic acid, once you got stones, you kind of that's been shown to soften them some. There's a Chinese herb called gold coin herb. It's a Lismachia, and this is just, we carried this. This is golden flower. There's other companies that make things with the Jin Qian Sao, I think is the gold coin herb. Oddly enough, for mild cases, you can use dollarweed.
Oh, nice.
Yeah,
Yeah, I agree with that.
Dollarweed is specific for pennywort, dollarweed, hydrocolon. It's the weed in your yard. Make sure that you use boiling water to start, because it's often in marshy areas and you don't want amoebic dysentery on top of gallstones. And there's some preliminary research in Chunca piedra, which is the stonebreaker herb that grows wild here. Make sure you have the correct genus and species. There is a same genus, different species that's mildly toxic. Did you type in Chunca piedra?
No, I'm dealing with something
Okay.
else. I will do it though.
Chunca piedra is primarily for kidney stones, but there has been shown some benefits. The trick is nothing works quickly on gallstones, so that you're looking at, besides lifelong dietary changes, usually 6 months to a year herbal protocols in order to slowly start to break those down. And I think the malic acid is a good addition to that. After that, it's, putting the right things together can be really, really helpful. And if you don't change your diet, it's just not going to win. And I hate to say it, there's a time and a place to get the gallbladder removed. It is dangerous, and it can be an emergency if it is blocked. The gallbladder is such an interesting organ because it is a reservoir for the bile, and we need bile to emulsify or break down our fats. The bile actually comes from the liver. So if they take your gallbladder, the liver over time will take over that role. But what they fail to tell you is you can no longer eat, you can't go and get the fondues and the fried chicken with french fries anymore, because the liver, you don't have a storage anymore. So the liver can handle small amounts of fats. So eating small amounts over time, being careful, watching your lunch meats, any of your fatty meats, stick with the lean meats. My favorite part, lose your chicken skin.
Oh my gosh.
Yeah, you would die.
No, I don't eat the chicken. I only eat the skin. I can't even believe you just said that.
So That's my 2 cents on the gallbladder. I got nothing else
Okay,
for that.
so you have a choice because we have some
Throw it
things,
out there.
some
It's
things
all good.
being like added on. So do you want to deal? Do you want to even come close to jumping on Wyatt's Bell's palsy craziness?
Yeah, Bell's palsy.
Well, it wasn't the Bell's palsy. Remember,
There's a bunch of other crap
yeah.
going
So
on.
I'm gonna go back up to Wyatt and read out Wyatt's, and then we have somebody asking another question too on top of that. And so, okay, so let's do. Oh Lord. Okay, Wyatt's got a crazy one here.
I remember some of it. So there was a lot of emotional issues going on. I think there was digestive issues. But sometimes, so, and this is just good herbal medicine as a general thing. Like, we always
Right.
want to do a full intake. We want detailed information, looking, sometimes even going into when you were in utero, in the womb still, can have impact, and where you grew up, all of those things have impact. But when somebody comes in and says, I get pneumonia or I get bronchitis, 5 times a year, and they currently have an active infection, they don't care about fixing your immune system right now. They want to stop. They want to stop hacking up a lung right then. So if you've got an acute issue, sometimes we have to deal with the acute issue before we go chasing after the chronic, more complex issues, and we can take those into account. And so in the case of Wyatt's, and I don't know if you found it.
I'm trying to, yeah, like it
So,
was way bigger than that.
Wyatt, you had somebody who it sounded like literally for their entire life they were all jacked up from a physical and emotional issues.
What's important is the medicines that they were giving and switching them back and forth from doxy to steroids. There was some issues with now going to be on Cipro, and nothing was working until, for the Bell's palsy part of it, until they started giving his formula, which was equal parts of mullein and St. John's wort and blue vervain and skullcap, which I can see. The original thing is what I lost. I wanted to know.
So I'll add to what you were saying there. So Bell's palsy, again, paralysis. I forget which one of the cervical, not the cervical, cranial nerves, and it causes that one side drooping of the face, and it kind of looks like a stroke. So here's the interesting thing. That's usually an acute onset. That's a type of wind invasion, like we were talking about earlier. And so in Chinese, we treat this like a cold and flu.
Here, let me do it for you. So you were right, had a history of trauma, but a decade of staph and staph-like reoccurrences.
I forgot about that.
Yeah, the petrochemical transmission fluid, exposure to automotive-related toxins, now on to the Bell's palsy, and started with intense clenching of the jaw, odd feeling in the body, difficult walking. It sounds like a major neurological thing.
Yes, and I'm going to totally cheat, and I'm
Says he's a tough guy, but admitted sobbing through a meal.
So obviously a good blood work would be important, that there may be some anemia or some B12 or iron deficiencies going on there. And you could argue supplementation like glutathione and B complex in order to help with detoxification from that exposure to
Don't
jacked
forget
up
that
stuff.
he's probably frantically trying to write.
Yes, I know.
Okay.
I know. And it's all recorded. It's okay. And I know Wyatt knows most of this.
Yeah, and Wyatt, contact us back to redo what Bob's
Wyatt,
saying.
I'm going to say, so it's interesting, but I'm going to go back to the Bell's palsy, but the clenching in particular, because we think of Bell's palsy is a paralysis or more of a slack, drooping kind of thing, and clenching is very different. And so if there's a clenching of the jaw, clenching,
Started with that.
So that's actually an interesting anomaly. So all of those things that I said about the shingles outbreak, we could also
100%.
look at. So the Xiao Chai Hu tongue, the Guizhou tongue may be appropriate based on whether the tongue is red or white. But I'm going to throw some Western herbs at you that, think colds and flu, think diaphoresis, so things like yarrow and elder, but chamomile will be huge on this. Chrysanthemum would be important, obviously a crap ton of probiotics to start to repair the gut. But now I'm going to throw some weird ones at you. because there's, and I'm going to type this because I don't know that Renee knows how to spell this. So Buzang Ichitang is a formula that we use for prolapse or things falling down. And sometimes I use this kind of post Bell's palsy or for chronic Bell's palsy. And I think what's more important is some of the herbs that are in here are also Western herbs that you have access to that you can actually, some you can wild harvest, some you can access. Astragalus for the immune system. Obviously, he's got some challenges there. Also in that formula is Chaihu, which is blue chlorum, which is pretty easy to access for a Western herbalist now. And Sheng Ma. And Sheng Ma is black cohosh.
Oh, good call. High five.
Yeah, so black
Yes.
cohosh, if you look at some of the eclectics and read back in there, black cohosh will be very specific for what this guy's dealing
Yes,
with.
good job, because he's got that wild up there.
Yeah, you can just pull that out of the ground. But you could also look at
That's great.
Ura the Gato, cat's claw.
I was typing that. We're so funny. I'm typing, and you're saying the things I'm typing.
And that can, and so there's a Chinese version of cat's claw that's easier to source sometimes and cheaper, Goteng. And you can also look for Tian Ma, which is Gastrodia. I think I'm spelling that wrong.
It's phonetic. Strodia.
Yeah, no, I think I got it. So those can all be helpful. You might, it's funny, and I think you have it growing up there as well, or you can at least find it somewhere. Obviously, and I think you got some access to the flower essences for that emotional aspects and the abuse, but look specifically at Lady's Mantle. And do a little research. I think we've talked about Lady's Mantle on here in the past as well, but specialized cells, and we call it dew, but basically the Lady's Mantle will exude water out of the top major veins, and it will collect in the center. Gathering that up or having him gather that up and drink it is specifically for trauma, sexual trauma, and the like. So that can be something, and flower essences just as a general rule. But look at the blood work, because yes, without a doubt, he has sexual trauma, PTSD, all of these kinds of things, compromised immune system that you may be spending the next 20 years trying to work on recovering his digestive and immune system. But the reality is anemia will show up as poor sleep, nervous behavior, restlessness, and uncontrolled crying. And so
100%.
So we don't usually we don't identify guys as anemic, but very, very possible, especially if he's a similar build to you.
Well, the other thing
Wyatt.
is the exposure to the transmission fluids and those kind of things can cause a depletion that we wouldn't normally expect.
Can you type in serene spirit? So,
Yes.
And so as a follow-up, once you get through the Bell's palsy, if you do see some signs of anemia, the thin, pale tongue, dry skin, thinning hair, things like that, Ganmai and there's a version of that called serene spirit. I put the Ganmai in, just do the serene. That might be helpful, just trying to create some stability for him as he processes through some of that crap. So I don't know. Hopefully that was helpful and gave you a little bit of direction.
I'm gonna Wyatt in particular too, because I'm looking at your formula now. That's good. You're doing a good job.
Oh, no doubt.
And let's add in Jamaican dogwood or black cohosh for the pain.
Yeah.
And you're doing a good job with that. That is correct.
Yeah,
and
black
maybe the milky
cohosh is-
oats to protect his nervous system.
Mm-hmm.
Yeah, and so that's a great thing.
Everybody forgets some of those. We always think black cohosh is for menopause, and it's like,
No, nothing's for nothing.
So,
That's not what we do.
That's such an underutilized herb, the black cohosh, for everything from unexpressed rashes, to spasm, in particular in the lower body. It's an antispasmodic and diaphoretic. Just so many endless uses for black
Some
cohosh.
bleeding in the stool, he's saying.
Yeah.
Yeah, like
Yeah.
poor guy. This is like we'll try to help you
And
out.
so
buddy.
if that bleeding in the stool, if there's, I just assume all your
He's
people have
probably
poor diet.
anemic
He's probably
too.
anemic.
He's anemic.
Yeah.
He's deficient. Think of it just as deficiency, and that's causing the pain to be way worse and to spread and to move all over. And so, all right.
All right, what else we got?
Okay, so many things.
We got a half an hour left.
Oh my gosh, so many things. All right, so okay, I gotcha. So we're gonna go back to our new friend on here. That let's do. So the question was, but I had to dig a little deeper. The question was, can we suggest anything to replace St. John's wort that wouldn't cause sleepiness? And of course, my response was, well, I didn't know that caused sleepiness,
Yeah.
like in my head. And so I started asking why he's taking it, and it got real deep. Okay.
I missed all of it. Sorry,
Right.
you
And
got to
so
fill
what
me in.
happened was there's an injury. So I'm moving through it. There's an injury using it for myself, spinal cord injury, C4. And I wrote pain, repair. We went back and forth for several things. Combo, which I thought was a great combo for that, of St. John's wort, astragalus, and Szechuan peppercorns.
Okay.
And I was like, yep, that sounds okay. That's like, yes, but, and so we're going back and forth with that. I said,
So when I saw the astragalus and Szechuan peppercorn, so
Right.
he's in L.A.
yep. And so pain, movement, neuropathy, repair, question mark, was, that was me going through that. Trying to get a reason for why you're using it to see what our replacements would be. Neuropathy and digestive repair would be an answer that he was given. And so we're going back, and I can't see you, so I'm assuming, don't let me offend you by he, if that's not
Yeah,
who you
sorry.
are. Like, I can't see. And so, so we went through that. So let's start talking about a little, because it kind of fits with what we're talking about. So basically, he's got a C4 injury, and the St. John's wort portion of the formula is causing some sleep. I argue that's a stress reliever, and it's bringing him down. It's probably not
Yeah.
causing sleepiness. And so what can we do to help repair that, as well as he's using it for digestive issues, which is very correct, considering how we think of the mind affecting the gut.
So-
And
And I sorry, it's like, go, you got to go see somebody. Don't treat yourself. But that's certainly a complex, and so getting things to the neck to try to repair the cervical if there's
Guiding.
nerves. And I know you've asked a few Chinese medicine questions, so I'm going to guess you know some of this. Gegen, which is kudzu, Gegen, the root. And you can find this as, it's a soup thickener as well as a Chinese herb.
like in the market.
Mhm.
Yeah.
And so we use this specifically to guide to the neck and shoulders for spasm. There are some other formulas with some modification that may be effective for that. Shentong Zuyu. Shentong Zuyutong is for blood stagnation in the upper body. So if it is trauma related and it's fairly, even if it's not fairly recent, from a Western standpoint, the mullein root and stalk can be super helpful in aligning the spine if there's actual spinal injury.
And those will not cause sleepiness in any
Yeah.
way.
And I might suggest Solomon seal as well, as having some repairing some of the
Do you care?
ligaments that are stressed along there.
Do you care if it's English or Chinese?
It don't
Because
matter.
it's the steam versus not.
Oh yeah, it doesn't matter. The Huangjing is the Chinese Solomon seal. Huangjing. Sorry.
I was about to put WAN.
Huang.
And then what,
Huang.
JI?
Jing.
Okay, I was about to put WAN.
There's other versions I like the Huangjing best.
That's
It
so
tastes
funny.
good too.
So funny.
But also, and this is always one that I think so overlooked for tissue repair and fascia. Because a lot of times, if this injury is now a couple of months old and it's no longer showing up, it's oftentimes there's muscles spasmed around there. And, so things like the Gugen, the kudzu can help relax that. But oddly enough, people don't think very highly of gotu kola, Centella asiatica. And for fascia inflammation, and seems to gravitate to the head and neck, I just think it's such a phenomenal herb and doesn't cause sleepiness.
It has the tissue repair component to it,
Yes.
plus the nervous system guiding, and so that should just be in there. It's good for our brains in general. But really, you're looking at not relieving the symptom. You want repair, and it's something that a doctor would tell you isn't possible, and I think it is possible.
Yeah.
Like, we see it happen. We do it on ourselves. We know that it can help.
And I'm going to say, something Renee said that's kind of, it was in passing, but I think it's vitally important sometimes. When we do things that are tropho-restorative, there's your $5 word, things that are for adrenals and stress and things like that. So when we think St. John's wort, when we think milky oats and so forth, and people go, oh my God, it made me so tired.
Yeah.
It's that you were at such a high state of stress that you've been made to feel normal again, that feels like exhaustion.
Yeah.
And the reality is now you're running at the same speed as the rest of us, which is normal. And so it is important to recognize oh my God, I can't keep my eyes open, which also means maybe you need some sleep. Or you change the timing of some of those things like a St. John's wort or milky oats to nighttime, so you get a more nourishing night's sleep. But generally, if it's just like I'm not as high hover as I was before, that's actually called normal. It's if you're like, I can't keep my eyes open, I'm falling asleep, then maybe it's making you more sedative. But St. John's wort's not a sedative.
And
generally.
that's why I said that, and that's why I started asking the questions. I wasn't meaning to be rude, more than like, hey, that doesn't normally make you tired. It can make you feel much better and ready to move and be more active.
Yeah.
And so it brings you up. It's sunshine. It picks your head up.
Yes.
Yeah. And so it's the opposite effect. So when we see that happening, we're looking at adrenal fatigue and exhaustion.
Yeah.
And so I'd like to try to replace that for you.
Certainly a broken neck would cause me some adrenal burnout.
Absolutely,
That's
100%.
super stressful.
Yep.
I don't know. I think we answered that one pretty good.
Yeah, I think that, we can absolutely ask questions or have anything to do with that. Do you want to, let's see what our time is.
We got a half an hour.
We have a half an hour.
Come on, crank them out.
Do you want to turn completely left on it and start talking about if you had gum bleeding and there wasn't really any reason for it and you've done the normal dentist thing to be healthy, what would be your favorite herbs for dental health in general, cavities, and gum bleeding, even if you didn't think you had the plaque or gingivitis or whatever would cause it? What would be the favorite things for oral hygiene?
There's a great book out there by a friend of ours on, oh my God, her name just flew out of my head.
Leslie Alexander.
Thank you, Leslie. Leslie Alexander wrote the book on dental herbalism. It's funny, there's a couple of different ways to think about that. So if we've ruled out things like gingivitis and plaque and all the usual things, it's like, no.
Has gone through the dentist road, isn't working.
Yeah, and so there we go. We gotta get Leslie's name. God, I am challenged by cameras. There's Leslie's name. She's awesome. It's funny, she's starting to do one of these kinds of things as well. There's two different ways to look at it. One can be some nutritional deficiencies. And the other one is definitely more from that energetic mindset of a lax tissue state. And so I didn't see who wrote that, but that idea of I'm going to say medically words first. So capillary fragility.
Capillary fragility,
yes.
Without the accent.
Which means that basically your blood vessels bruise easy overall. And so if you're like brushing your teeth every time and you're spitting out a bunch of blood, like, oh no, those tissues are just sensitive. And that can be vitamin C deficiency. So there's an easy, some basic supplementation. You would actually notice a difference within a week or two if it was a vitamin C deficiency.
Could you infer a bigger problem with that, in that if your gums are bleeding and the vitamin C fixed it, that maybe there's an overall capillary fragility?
I would say,
like an internal?
Yes, that you would also probably see like slow wound healing, frequent colds and flu, blah, 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 an overall nutritional deficiencies.
I was going to ask
because if it's not like, no, I eat things that are high in vitamin C, and there are,
Right.
you're not limited to oranges to vitamin C. There's a million different foods out there. It could actually be a low stomach acid that's not allowing for it.
That's a good
Also,
call.
there can be medications to deplete vitamin C, everything from birth control, but also blood sugar issues. So any kind of metabolic syndrome or diabetes can also have a role
What
in
would you-
diminished vitamin C.
What would you do if you thought it was low stomach acid? How would you fix that personally?
Take HCl. You can start with digestive bitters. HCl is the quicker answer, but you can also use alfalfa sometimes as a way to slowly start to generate that. But taking hydrochloric acid pills is a nice quick answer for it. The other way to go is, so that would be more of a nutritional deficiency caused by, got to figure that out. But if it was a lax tissue state, if we came from that perspective, looking more at the energetics, we would see other lax tissues elsewhere. It could be a loose stools, it could be genital sensitivity, rashes, things like that. Could be a drippy nose, just kind of overall fatigue. We could do things that are high in tannins as a mouthwash. If it was like, no, it's really just I got bloody gums. Just doing like oak bark decoction and rinsing your mouth with it could be sufficient for that. There's lots of other tanning. Heck, black tea. It makes some really strong tea.
Okay, so there's lots of
Hey, Samaya, I didn't know you were
lots
on
of
here.
chatter around this.
Oh lordy!
Okay, so let's go to
Open up a can of worms as
yeah.
usual,
So
right?
so there's two things going on, and I'm here to say, Jeremiah, if we don't get to you, I will answer your question. If you hold on, I will text in and we'll talk about it. If
Yeah, we got a great crowd.
Yeah, if we
I'm
don't
loving
get
how
to
many
you,
people
I
are
will
on
make sure
here.
your question gets answered one way or the other. If you just hold on a second.
Try not to go over at 8 o'clock, but if we have
Well,
to.
we should talk about it. But this is relevant to what you're
I
talking
didn't
about.
see it,
So
yeah.
Samaya says, with respects to the kidney presenting in the teeth, you'll have to say something about that. Could you comment on how the kidney issues could be presenting themselves as tooth issues?
Okay.
Yeah.
So,
Does that make sense?
So Samaya doesn't mean your actual kidneys. She means the cool, freaky, deaky, energetic Chinese kidneys. And so in a lot of traditional cultures, the way we describe, before we had x-rays and surgery and all the cool sciencey stuff that we have now, we had to have a way of understanding what is aging, why do all the things that happen to us. And so a lot of times we'd make these correspondences or relationships to different parts of the body, organs, and so forth. And so the Chinese Ayurvedic, all the traditional cultures do this. In Chinese in particular, we associate this energetic idea of the kidney with aging. And so we see its relationship to urination. So, when we're 20 something, hopefully you're not getting up, 10 times a night to pee. But as we see the 70, 80, 90-year-olds, or sometimes they're peeing a lot. So the bladder doesn't hold the urine as well, any number of different reasons why, but that tends to be aging. We also associate it with hearing. So our hearing declines as we get older. Can't hear you, I'm getting old. We associate the head hair, the graying or the loss of the head hair we see as a sign of aging. We associate that with the kidneys. We see the bones become less flexible and slower to repair, and we see osteoporosis and things like that as we age. And so we associate the bones with the kidneys as well. And for the Chinese, they see the teeth as an extension of the bones. And we also see the loss of teeth as we age is a common occurrence. So chronic teeth issues can be a sign of weak kidney energy. teeth problems as a whole, there's some argument energetically, and I'm sorry, I'm going straight up energetics here and getting fancy Chinesey on you. We look at the teeth as the kidneys, although we have a channel or organ association with each tooth. You can find a dental organ energetic chart. If you Google that, you'll find it. I don't remember. I always have to look them up. Also, when we see bleeding gums, we can associate that with a fire condition. So heart fire or a viral condition can have an association with bleeding gums. And it's interesting, if you talk to a dentist, there is a correlation between dental hygiene issues and heart
health,
disease.
yeah,
And so the dentists will argue, no, you got to see us so we keep your heart healthy. The Chinese wrote about that 2,000 years ago. They're way slow. What are the other things? Oh, and we can also see a role in digestion. So stomach fire, we'll see that because we see the mouth as an association with the
So a stomach
the
fire
digestion.
being too much or
Yes.
not enough?
No, too much.
Oh, that's interesting, considering like we know why she's asking, and that she's got some sassy kid on that end.
Yeah, and so ascertaining the why, and so that's like 5 different ways to look at one symptom. So look at all the other symptoms and try to ascertain. If we're talking about the little one, I would say I'd be more inclined to go with the low stomach acid as a very real potential issue on that one.
Okay.
Oh, and somebody, I just looked up and saw, because we associate the pregnancy with stealing that kidney energy from you.
Literally sucking the life out
So
of
we
you.
see, especially on 2nd, 3rd, and 27th pregnancies, an occurrence of tooth issues with difficult pregnancies where you're getting bed rest and so forth. And the doctors will just go, I don't know, it happens. And I would say, nope, your jing has been dinged. Your kidney chi is being stolen by that chi sucking phlegm ball
I had
that
my
we call
first
children.
cavity pregnant with the second child.
Yeah, it's a very common occurrence with
Yeah.
multiple children.
Yeah, absolutely. Okay.
What else you got?
So many things.
Come on.
Oh my
I'm
gosh.
on a roll.
Hush. I gotta tell you. Okay, so this I think is very, very good in part Chinesey, and we'll go for this.
And anybody who doesn't know, this will all be on YouTube. Tradition School of Herbal Studies. Make sure you subscribe. Lots of cool videos, lots of educational stuff. All the past ones of these, so that we never know what we're going to get. And we'll be doing this again on the 24th of September.
Let's go through. And Wyatt said we were cutting in and out at some point.
Ooh.
And so Wyatt, I'm letting you know that I will get you a list of anything that's needed that you didn't hear. What
Yeah,
Bob
I'll
said.
have this uploaded on YouTube probably by Sunday. And that's a really good place to look at comments. It's hard to follow the comments on Facebook after we do
Okay,
this.
so hold on. Let's get to this.
Yep.
Okay, do we have any, and I can't say the Chinese properly, but do we have any experience with teasel root, which is Xuduan?
Shuduan.
Okay, for connective tissue, I'm thinking about post-op for torn ligament and tendon repair. Can you recommend the process will facilitate? I do have something to say about this, but that reminded me of something that I need to say about Wyatt's case real quick. Wyatt, his pain got progressively worse after being put on the Cipro, and it went to an all-over connective body pain. He could be having a reaction to the Cipro.
Yes.
Please look up the Cipro-Leverquin tendon ligament tear thing, and we'll help you through
100%.
that.
Yeah, I didn't see the question.
It's excruciating pain all over the body, and that could be exacerbating the symptoms all the way up to the Bell's palsy.
And certainly, if that is an issue, the Solomon seal, which grows
is
wild
correct,
up there, and as much CoQ10 as they can afford.
Yes, and so I'll make sure you hear anything about, but go research that, and you'll be like, oh, this sounds like his symptoms.
So post-op.
So I would even do post and pre if we could, but post-op. And so I want everybody to know who's not familiar with it, what teasel is. Say the Chinese for us.
Shuduan.
The Latin translation of teasel is to restore all that is broken. That's what teasel means. And to understand that we give that to elders solely just like a cup or a quart a week just to have an all over body feel great, like feel better, like a restorative. And so thinking of it as a reparative for your tissue, your ligament, 100% I think is a correct thing to do. It's something that as we age, we'd be doing it anyways, but that combined with something like a Solomon seal, both topical and internal, would go a long way, especially if we had a nerve repair in there too, to go a long way to repairing a post-op surgery tendon and ligament. And for those of you who don't know, we have great experience with this, that I was a professional athlete and I've had multiple surgeries. I, right now, as we speak, have 2 detached ligaments in my knee, and I'm still doing everything I'm supposed to be doing. And so we know that it works. So, Bob, do you have an experience with the teasel root as a Chinese herb that will reflect, because he asked it as a Chinese?
So we don't use it as a single in Chinese very often. We'll usually use it in, and I'm totally blanking on half the formula name. So Great Mender was something that was made by Meiwei, and it was like Jinggu G D something Chengguan. I'm butchering that. I can't remember the proper name. And then Golden Flower makes a Trauma 1 and Trauma 2. That along with many other herbs are in there to help with post-op. And so a lot of times, if it's like a knee replacement, I didn't see the question, but if it was like a knee replacement or something like that.
It wasn't specified.
Or torn ligaments and so forth, certainly those are appropriate. I like the Trauma 1 and Trauma 2 in particular. Trauma 1 we use it for the first 2 weeks or so. Trauma 2 from like 2 to 4 weeks to like 2 months out. Any kind of if you're able to use topically, Dit Da Jiao, Di Da Jiao, which is a trauma liniment, is very appropriate as long as it's not, don't put it on an open wound or stitches. You can also look at vitamin C internally, zinc, and B vitamins. Presumably any surgery is going to get antibiotics, so make sure you're using probiotics as well. And I think I heard the word ligament and tendon. I like blue suede shoes, Gu Sui Bu. Sorry, I come up with Gu Sui Bu. I think I spelled it right. There might be Gui. Gu Sui Bu, and I totally forget the Latin name of that. It's a little hard to find sometimes. But that and the Solomon seal, the Huang Jing, is such a great combination for ligament and tendon damage. There's a number of other herbs that are classically used for that, but those are my big heavy hitters, along with the Shutuan. The Shutuan is such a winner, but it will do better in formula. And the dosage of the Solomon seal is yes, like you can't do enough.
Also making sure that you're staying hydrated, adding the milky oats in to help with any nerve damage that goes from just being sliced into it, and then adding the gotu kola in for the same reason that it's guiding to the nervous system but specific for connective tissue at those areas. And the milky oats and the gotu kola will help with that inflammation and that binding back wherever the surgery was.
And I'm going to say, like, if you're going in, like, if the surgery hasn't happened yet, that it's very possible, like, looking at the lead up to the hospital stay of the vitamin C, vitamin D, probiotics, looking at those to strengthen the immune system, get the body as prepared for the stressors we're about to put on it ahead of time can be super, super helpful.
All right, so I hope that would help. That helped satisfy. I'm trying to go through the questions to make sure there wasn't more follow up to that. I feel like that's okay. Kristen is talking about, which I've never heard you say this, so I answered it. I've never heard you say that you know what Avens is, which is a plant. It's an old timey thing that Michael Moore would have talked about. No, the Latin for it is I'll find it. The Latin for it is like something with a G. Avens, and I know it. It kind of looks like, actually, in all reality, it looks like a.
Is it a gallium?
It's not a gallium, but hold on, I'll find it. Like we'll find it. GEUM, Rosaceae.
No, he's from
Okay.
Chile.
Oh, hey, nice
he
to
came
know.
to the animal care class.
So he's the
I
one
know that
you were the
name.
one they were talking about with connective tissue. Hey, by the way, since you were at the not talking about the Avens, since you were at the animal care class, all those things we said were fine for the animals as well. Like
Except for the vitamin C.
Not the vitamin C, but the Solomon seal,
Yes.
the milky oats, and the go-to quote. That's all something we would use on an animal who'd gotten an injury or needed a surgery on a joint or something like that. Okay, so Kristen was just asking about using Advins for any mouth issue or styptic or bleeding. It's an old-timey Michael Moore thing. She said she heard Jim McDonald talk about it, and I'm like, that's why it's because they all were under.
Yeah, they all studied.
So nobody knows it. It's an old-timey thing. I said what I needed to say about it. Didn't know if you wanted to add in. I never heard that out of your mouth, and so thought you wouldn't have anything to say. Mm-hmm. Okay. The only other thing that we did not deal with was somebody's confused about adaptogens in a general sense. Do we think they're real? Do we think they work? Do we think the list is the list? Who do we go to?
Okay.
What do we think? What is?
I got opinions on that.
What do I do about this? Da 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 da.
So
I brought this just because.
so we can spit on it. No.
Yeah. No. This one's okay.
So adaptogens. There are many definitions for adaptogens, and the one that I use generally is adaptogens are herbs that help us adapt to stress. Where it gets confusing and very debatable is, but generally considered safe. And I would say, no, there are many herbs that help us adapt to stress, but may not be appropriate. Not that it's going to kill you, but you may have an adverse event from it. So, and I hate to say it, I am a animal rights advocate without a doubt. The way that's usually tested is you take a bunch of mice and time them in a bucket of water and see how long they can tread water.
Wait, hold on. Let me rephrase what Bob is saying. Not the way we would test it. Way back in the day, tested. This is how it was invented.
I'm sure they rescue them before they go under. But then they feed a group of mice a particular herb and then see how that works. And and there's a question that just came up I can talk to as well. And if they are able to tread water for a significant longer period of time, then it's considered that it helps them adapt to stress. That's a way that we can create a stressor on a mouse, and then we see if it has similar effects. The Russians were actually the ones who started kind of the process and the languaging around that, specifically with their cosmonauts and then ultimately their athletes, because we saw that had a role in helping people adapt to a variety of different stressors, everything from space, but also professional athletes. So we saw it showing up in the Olympics, and now all of them are banned in the Olympics. So yes, they're real. Because we have some clinical trials on mice, admittedly, but we do see that they are effective. I think they're overdone, and the magic is in the dosing and matching the adaptogen to the particular individual's energetics. Rhodiola is a great herb that helps people adapt to stress, but it's one of the driest herbs out there, and so for somebody who is thin and wiry and tend towards dry, rhodiola would be horrible for them. It'll actually cause agitation. It will cause stress. Where milky oats also is a nice adaptogen, but better for the dry, wiry person and will make them more resilient to handle things. And so I think that the problem is we read the word adaptogen and we think everybody should be eating those, and we're taking a little capsule, which is probably a extremely subclinical dosing. So really, like, looking at energetics, looking at traditional use, looking for who this, we got to match the herb's unique properties to the unique individual, rather than saying, here's a bucket of adaptogens, it's bound to be good for you and make you live forever. It's not the way it works. And we have expectations of that kind of thing. Like, everybody needs ashwagandha, everybody needs Shazandra. We really have to be very specific about those things and looking at energetics of the plant and the person, or the critter, I should say, to get the best results. And I saw something about MTHFR.
Yeah, so just it would expression of, hey, do you know what this is? What to do with it? How to do with it?
So
do that.
MTHFR, I won't even pretend to be able to say the medical words. It's
write it
inappropriately known as the motherfucker gene. It's actually two different genes. So we kind of discovered this MTHFR through the Genome Project. And if you have both of those genes turned off, you're kind of screwed and susceptible to a lot of stuff.
Way to paint a good picture.
If one's turned off, it's mildly challenging. It doesn't allow you to methylate.
I think I have 3.
Yeah, there might be a third that they discovered recently.
I think there's 3.
So basically it's about your ability to methylate or process your B vitamins, your B12, excuse me. And there's a role of B6 and all of that as well.
I'm going to write it out for you guys.
So
oh my gosh, it's ridiculous.
Generally consider, yeah, that's why I was like, I'm not even going to try to say those words. I generally say that if you suspect, or if you, through genetic testing, have the MTHFR expression, getting a methylated B complex can be very helpful. There's some products that have all fancy blends in them that help with methylation a little bit. My short answer is I believe that a lot of people who are dealing with that have a low stomach acid or lack the intrinsic factor in their stomach, which is the magic thing that happens that allows you to process B12. I think it has a role in stomach acid. And I find that the betaine is very helpful, and so you can certainly get HCl with betaine and a good methylated B complex, or you can eat beet tops and beet greens or beet powder and start to utilize. It just happens that beets are very high in betaine. So in kind of a daily dose can be very effective.
Greens or the whole beet?
The whole beet. So the greens are better for you because they're lower in sugar, because the beet root is so high in sugar that it has its own little things we have to be cautious about. So I'm going to say, get a little bit of beets in you every day. Look to what other things like low HCl may be an issue. There's lots of possibilities for that MTHFR. I believe it's funny. Will Morris and I had a wink, wink, nudge, nudge at an AHG conference, American Herbalist Guild conference, a while back, and he was like, "What do you think about this?" And I was like, "It's a thing, but I think it's a fairly modern thing that somehow we were having this success with it before, but we didn't have a gene expression to talk about with it." So I think that we were addressing it in a different way without actually knowing about it.
What do you think?
I see some teeth questions that are popping up, and I see a new name on there, Tammy.
Yeah,
can you read that? Because I can't read that fast.
So
and I'm going to
well, we had 4 minutes, so.
Okay, and I'm going to put Leslie's book up there because that sounds more complex, but I'll
Recent
try.
filling went deep in pain and sensitivity in that tooth along the sensation across all bottom front teeth. Suggestions: trying to avoid a root canal with sore pocket for several months on a different tooth. Root canals are a scourge. They are so bad. Not only do we have a tooth, if you had to go root canal, we have a tooth powder that, and I've heard of other people, but a tooth powder that really, we have a friend who is on 8 years where he needed a root canal 8 years ago, and we've gotten him 8 more years without having to do it.
Yeah.
But really looking at the nerve repair of that. So trying to remineralize your teeth, which is a very, very normal thing to do nowadays, so that you don't have that exposure along the bottom of your teeth, and trying to work on neuropathy and nerve pain. Earlier, somebody had asked about restoring the bones in the teeth, and I just answered it because I didn't think Bob would have time. So looking at an internal of strengthening, like mineralizing of oats, nettles, and red clover, and comfrey as a wash, not as you don't drink that, you spit it out, and as a topical.
And let me throw in a few just short term, because like, oh no, you're dealing with potentially some deep pocket infection-y kind of things. So using this is I'm stealing this one from Renee. Salt and just packing it in salt can be
Yeah.
really helpful. But a lot of times I'll use a combination of spilanthes, clove, something with berberine, and so I'll use the huangs in Chinese medicine, coptis, but you can use golden seal. Echinacea is helpful in this. Lomatilla. And I'm sure there's something else in our tooth powder.
Clove.
But literally grinding that into powder, adding salt into that is super appropriate, and then dipping it as close to that as possible. St. John's wort, because there's some pain aspect in there. That combination will oftentimes literally draw the poison out. Oh, plantain. Gotta have plantain in there.
So what
And
What Bob was talking about with the salt is just that simple thing of, like you learn in third grade science, of the water distribution, that it will pull the infection to the outside and make an inhospitable environment for bacterium. So it's real easy and very, very caustic. So you dissolve enough salt in a small amount of water till it won't dissolve anymore. It will make you cough if you smell it. And then you just hold that in your mouth and then spit it out. And it can be warm or cold, whatever your tooth wants. And that will help to reset it nearly immediately. And that's something you learn when you're in the jungle.
And I'm so sorry that, what a great response. I love all the questions you all had. So
Please send us questions.
So I hope that you join us September 24th. The last Friday of the month is normally when we do this, but we had a conflict this time, so we switched it to this date. I hope that you all join us again. Send in your questions ahead of time. I know they all randomly pop up as you show up, and so that's even more fun because they're like, oh crap, I don't know. Please check out traditionsherbschool.com. Check out our class schedule. Remember that we've got things online as well as in person. So we love having people join us from literally all over the world for this and any of our classes. We've got free classes coming up next week. And this will be posted on YouTube, the Tradition School of Herbal Studies, as well as lots of other exciting things. So make sure you subscribe so that every time we launch a new video that you can check it out. If you write some of your questions or ask for clarity on some of the stuff that we covered tonight, we'll do our very best to jump
try
in.
to help 'em.
It is way easier to respond on YouTube than it is on Facebook. It gets super confusing. I hope we see you all in some classes. If you're local, please remember we got the Herb School here. Both the Chinese and Western programs are coming up. Our intern clinic is for both Western and Chinese
And
herbal
we do
care.
Skype appointments for that as well.
We've also got 6 days a week herbalists and acupuncture physicians here. And you can find out more at acuherbals.com or call the clinic or the school. And we'll get you scheduled up for an appointment. Thank you all so much. Have a wonderful long weekend. I hope some of you get some extra time off and enjoy what's less for, I guess, the start of fall. Woo woo. Mm-hmm. See y'all next time. Bye. And let me in.